You may have children, if not maybe a nephew or a niece, or you may know of a child or want children. That's why I urge you to think about this. What would you do if your child was like mine? My child has no friends. On most days, when I take him to the playground, I spend a good 20 minutes saying, "Look at that slide, how fun. Don't you want to get on that swing?" Yet he's running around in circles with a watchful eye on the exit gate, waiting for the right moment to make his escape. When he's finally free, he runs endlessly, without the slightest clue of what running into traffic will entail, or the dangers of an unsupervised child. On one of his best days, he makes it to the monkey bar or the slide. My heart fills with joy and I feel like, wow, he's getting it. Then all of a sudden, the friendly 5-year-old comes and says, "Do you want to play?" My child stares and stares and doesn't say a thing, while he sits on top of the slide, motionless. Once again, the friendly child says to my child, "Do you want to play?" As if my son didn't hear him the first time. Then the 5-year-old gives up, and I see how he goes and tells his friends, "Let's forget about him. That kid is weird." This is when my heart breaks all over again. The stabbing, shooting pain is as bad as the very first day 5 years ago, when it took all of me not to drop to my knees and scream to God for the injustice. That day, I saw my son's innocent eyes looking at me, and that gave me the strength to move on and face this. I finally got confirmation to answers my heart already knew for 2 years and 355 days. My child has autism. See, when my gorgeous baby was born, he had a rough start. He was in ICU for a few days, which is when my relentless efforts to find an answer began. The lack of education amongst medical professionals about healthy development in children is a problem that persists today. According to the Center for Disease and Control, 1 in 54 children is diagnosed with autism in the United States every day. Yet my suspicions that my child was not developing typically went unheard by multiple professionals for over 3 years. My desperation to find an answer led me to a never-ending journey of battles with doctors and of questioning my maternal instinct. Family was no help. After all, their grandchild, nephew, little brother or son could not be less than perfect. I brought my concerns to my child's pediatrician often, to no avail. My child was evaluated by 3 developmental pediatricians, 4 neurologists, 2 physiatrists, and a psychologist before the age of 3. No one was able to give me a definitive diagnosis, thus delaying treatment in the most crucial years of brain development. Oswald found that children in the autism spectrum group were diagnosed later than the children in the developmentally delayed group, despite early parental concerns. Late diagnosis is associated with increased parental stress and delays early intervention. A study by Alyssa Orenstein, PhD from the University of Southern California, found that children that are treated early, meaning before the age of 3, may have the possibility to lose the autism diagnosis because there's still brain plasticity. My son lost that valuable time, and I can't bring it back. The American Psychiatric Association reports that although signs of autism can be seen as early as 4 months old, the U.S. average diagnosis is older than 4 years old. David Mendel's research concluded that Black kids are diagnosed 1.5 years later. Latino kids are diagnosed 2.5 years later than white kids, placing minority children at a disadvantage in early access to care. Being a Hispanic woman living in one of New York City's inner city neighborhoods when my child was born gave me a personal perspective regarding the behavioral health disparities. When I lived in the city, access to healthcare was complicated. Delays in obtaining appointments were prevalent, often waiting just 3 to 4 months only to secure an appointment with a specialist. Moving to a suburb of New York has made the glaring inequalities in healthcare even more evident. Although disparities still exist for my child, appointments are feasible now. He can see a specialist within a couple weeks, and my son goes to a school with specialized autism programming. There's a chronic shortage of behavioral health care for our children. The states are failing to invest in our children's health. States like New York have the funds. In the year 2019, New York State implemented home-based and community programs for Medicaid children. According to the Office of Mental Health, that program is only filled to 25% capacity, and the children remain on wait lists. The fact is that obtaining qualified clinicians is more challenging than finding a needle in a haystack. Our children are waiting. Time is passing, and they will only get older, and things will not get better for them. The fact is that behavioral health providers are underpaid and overworked. Respite care workers earn more by working at McDonald's than by working with families of children with special needs. As per the Nursing Association of New York, while a hospital provides care for a cardiac patient, they get reimbursed anywhere from $28,000 to $86,000. When a patient has a hip replacement, the hospital receives about $9,000. For a one-day inpatient stay for acute psychosis, hospitals get less than $1,400 a day. There are 8,184 behavioral health facilities in the U.S., but only 12.7 of them have reported having a trained clinician who specializes in autism, and only 4.3% of them have a specialized program. Something has got to change. We have to walk into our congressman's office, advocate that services for our children are available, request new innovative technology, such as ask for behavioral health care services that are created specifically for children with special needs. Our children are worthy. They're entitled to equitable health care. If we don't fight for them, then who will? About 30 years ago, children like mine were institutionalized for life and experienced severe physical and psychological abuse. They faced forced sterilization and were utilized and subjected to medical experiments. Granted, I don't think this is happening anymore. This is likely not happening today. However, we still have a long way to go. Our children remain disserviced and forgotten. Just the other day, I was in a Board of Education meeting for my son's school. Now keep in mind, this is the good school, the school with the autism programming. They were going over the budget for the school, and they were accounting for all the students, except for 12. Do you think it's pure coincidence that there are only 2 special need classes in that school, and each class has 6 children? Something to think about, right? Although evidence-based practices are good for our children, they're often tailored towards making our children with autism accommodate to living in society? How about instead educating communities so that our children can live in society without being judged? Our educators, heck, humanity in its entirety should be educated that differences are acceptable and should be welcomed. What are your thoughts on that? The lack of societal inclusion creates much social and economic injustice, leading to depression and anxiety in people with autism, which ultimately creates poor health outcomes in these individuals. And this in turn increases costs to society. Our children continue to be discriminated across the systems. The educational system oftentimes doesn't accommodate their specific needs, or is embarrassed to admit they have unclassified children in their schools. The healthcare system continuously fails them. There aren't enough services available, and qualified clinicians are few and far in between. The justice system incarcerates them for engaging in disruptive behaviors without the understanding that people with autism engage in these behaviors because this is the way they express themselves. Society humiliates our children, makes fun of them, looks down at them, and is constantly just thinking they're less than. Remember the experience of my child in the playground and the friendly 5-year-old? Yes, unfortunately, at 5 years old, our children are already conditioned to judge and label others for their differences. It's time to make this stop. When will this stop? Will the differences ever be accepted? When will autistic children get the treatment they deserve? Having experienced the system challenges personally has motivated me to dedicate the rest of my life to ensure that other families do not encounter the same barriers that I did. Individuals with autism bring many strengths to society, including neurodiversity that enriches communities. They're a source of happiness and inspiration to many families, especially to mine. You see, having a child with autism changes your life for sure, but not necessarily in a negative way. After this experience, I was forced to draw my strengths, address my weaknesses, and I learned to introspect and subsequently view the world through a different, more defined lens. I have learned of a love that I never knew I had in me. I have grown. I now dedicate my days to helping families with children with special needs. I opened a private practice. I created a local parent support groups, and most recently, I started a doctoral program. Because I am going to have an influential voice in Congress, and I am going to create change. Early on in my career, I had grandiose plans. I thought I was going to save the world, frankly. I remember running a very successful women's psychotherapy group. Everybody in my clinic was intrigued. The supervisor, the clinic director, they all wanted to know what I was doing, that I had 12 women who never missed a group. My census was awesome. I was saving the world, remember? So one day I decided to ask these ladies, what is it that I'm doing? Why are you coming to group every week? And I had all these grandiose and delusions, I guess, or, thoughts about the reasons why they were going to say that they came every week. I'm too embarrassed to share the other things I thought, but those are just a few. The ladies all had one consensus on their answers, and that was they came to group for the coffee I served in the group. Whoever knew that coffee had so much power? So now that I'm a little bit older and I realize that it's quite unlikely that I'm gonna save the world, I realize that I can still make a difference in many lives. There are many things that can be done to help our children. Spending on children's health care is an investment to society rather than a cost. The benefits of children developing healthily accrue over the life course. The economic consequences of lack of services and behavioral health care are far greater than the treatment costs. Carolyn Belden, an activist for children with special needs, once said, "Equality is leaving the doors open for anyone who has the means to approach it. Equity is ensuring that there's a pathway to that door for those who need it most." I challenge everyone here to help me open that pathway for my child, for that child, for your child. That child that doesn't talk at 8 years old, doesn't play in the playground, and is only potty trained about 75% of the time, and has no friends, is mine. I ask you again, what would you do if that was your child?